Hello, I need to make another update for you because I think the last video that I made was, I may be mistaken because my brain feels like a mashed potato at the moment, but I think the last video I made was in the Eastern Cape. We're in the middle of the coronavirus outbreak, obviously the pandemic. South Africa is now being more affected, which is really concerning. Because there are a lot of vulnerable people here who are HIV positive, and 2 million of them are not on medication. 6 million on medication, but are still at risk. So, that's 8 million people that's a huge number that it could potentially harm. So, what happened was I went to Pimville to have a meeting with Clandler from the NTF Foundation about what we could do to help the children whilst the schools are closed, to see if we could run any small groups. And we had a good meeting. I managed to get there by combi myself, I think mainly because a lot of people are avoiding the combis at the moment, so actually it was safe for me. I was the only person in the combi from here, Orlando West, all the way to Maponya, and then I walked to Nompla's place where we had the meeting. She's using her place as a church at the moment as well. But then we had the news that night when I got back that the president gave a speech and there is to be a lockdown from Thursday night at midnight. So today is Tuesday. I went to Barra to see what happened. Actually, CeeLo, the psychologist, called me this morning, told me that they'd been told that the patients didn't have to come if they felt unsafe. So he asked me what I wanted to do, and I said I would come this time and just before the lockdown. So, and then Barra's not, it's sad because Barra Hospital is amazing, especially the mental health services, but for a catastrophe of this size, it's just not equipped to deal with it. The place has already run out of sanitizer on the way in and out, and people are coming from all over for this hospital, and so they're rightly so scared. It would be irresponsible for us as patients and for CeeLo as a psychologist to carry on travelling through Barra to get into the hospital, using public transport as well, coming from all over. It would just be irresponsible, because if this virus enters that hospital, it will be a disaster. It will be a complete disaster. In fact, if it enters Soweto, around 50% of the people could die in Sowetan, so it's a real risk. Me personally thinks they should close Soweto, because at the moment there are no cases here. So I cried at CeeLo again today as usual, but and I told him that actually now I am feeling scared. I wasn't feeling panicky about it before because of my background in microbiology, but now since it's hit here and the numbers are going up so quickly every day, fortunately there's no deaths yet, but the government are actually doing a great job at containing it and putting in all these measures. So I won't be going back to Barra until after the 21-day lockdown, which is going to start on Thursday. The military will be on the streets to help enforce it. Everybody must stay at their homes. Only supermarkets will be open, banks and clinics. So unless you're only allowed to go out if you need to get food or you need to go to the bank, everything else will be closed. Hotels and hostels and everything to do with tourism is closed down. I've never seen Vilakazi Street looking as dead as it did today. There was just nobody. The whole street was empty. And of course that's the hub of tourism in Soweto. That's where Mandela House is. And also, sorry, my brain. Desmond Tutu also. Vilakazi is the centre of everything, and also the museum opposite us, Hector Peterson Museum, that's closed. It's quiet, there's nobody. It's really strange seeing nobody. It's kind of nice in a way, not having the tourists come in and staring at you from a bus and taking pictures, but at the same time it's it's weird, and even locals you can tell are scared because the streets are that quiet. The taxis have driven me a bit mad since I got back, because they've obviously been beeping and beeping and beeping because they're desperate now. As I said, nobody wants to get in the taxis anymore, so the taxi industry, the combis are going to suffer as a result massively. But if you do get in them, you'll be safe, because you'll find there are very few people in the combi because of, exactly because nobody wants to get in them. So the taxi driver will be at least a bit better off. So that's the update with Barra and my appointments. I did have a feeling that this was going to happen. It would be totally irresponsible to carry on with these. I'm just going to wait until somebody's just come into the room, so I'm just going to wait until... Sorry, I'm not sure how to pause it as usual. So that's the situation. So there's around 500 cases now in South Africa, and that's happened over 3 weeks. It started off as the 2 cases and has gone up to 500. It potentially could go up to tens of thousands within the next week, and within longer than that it could go up to hundreds of thousands, which is why it's really important that this lockdown happens now. So it will be 21 days. So CELO suggested that I just use the time to recuperate and look after myself, pay attention to my needs. I think we just have to see day by day at the moment what's going to happen, but this could be an enormous disaster for South Africa. At the moment, people in Europe are saying it's much worse there. Obviously, there are more cases, there are more deaths, but there's money in a lot of those countries, and that's one thing here that is severely lacking. The economy is very much struggling already before this hit, so the health service was struggling already before this hit, so it's worrying. There's a lot of people in the rural areas that can't be accessed by the mass communication campaign. There's people in townships that just cannot get hold of sanitizer or even soap sometimes. So there are a lot of vulnerable people here, and those with immunocompromised position as well. 2 million people. If those 2 million people are affected, it's highly unlikely that they will survive. So it's really sad, but I do think the government are doing the right thing. The private sector have agreed to work with the government, which is a positive, I think, and hopefully that will continue after it's over. That could really strengthen the healthcare system, and society in general could be changed for the better. There's a lot of money in the private sector, so that hopefully will help us. So there's 3 designated hospitals in Gauteng, Tembisa, one in Parktown and one in Pretoria, which are for anybody who's actually tested positive for the coronavirus. And other than that, if you have symptoms, you're not supposed to go near a clinic. You go straight to one of those hospitals for testing. The mask is not that effective, so it gives a false sense of security. I do wear gloves. If I'm passing through somewhere busy like Barra at the moment, the gloves are the way, and definitely if I was leaving Soweto going into the CBD, I'd be wearing my gloves. And then it's just a lot of making sure that you're away from people who have symptoms of cold and flu, which is difficult because so many people have these symptoms here all the time. There are so many colds and flus. People have TB here. Everybody who's got HIV is susceptible to TB. There's a massive TB burden, which obviously means these people have a dry cough quite often, which is one of the symptoms along with the others as well. So they screen people at the moment. We were screened, I think I said, as we came through East London. So temperature on the forehead here. So I don't know how effective that sort of screening will be, but I think they're trying to intensify it. As for my psychology, I've told Zero at the moment I'm just feeling drained. I went to Pimville yesterday, as I said, and for 2 hours I fell asleep on Non-Play's couch, and Landler couldn't wake me up. Non-Play struggled to wake me up, and they just left me, so I was just gone. And I think it's because I've been trying to catch up with all the information since we came back and try to put things in place for the children to help where I can. Try to keep up with the World Health Organization as well as the South African government, and I'm protecting as many people as possible, and it does take a toll. So I'm feeling very drained. I feel like I could just fall asleep again. I hadn't even taken my medication that time, when I fell asleep, so I do feel afraid at the moment, not necessarily for myself, but for the country as a whole, and for South Africans living here, citizens that are the most vulnerable. I'm scared right now. It's not, it's been 100 years since this has happened last, and that was another flu-type pandemic. Hopefully we've come a bit further now medically, and they're testing vaccines already, which is good, and also therapeutic medication to try to treat the cases. But it's just scary how the rate at which it's spread and the level to which it's spread it's just uncomprehendable. This pandemic. Even for me with a microbiology background, it's just, I guess, as I said, it was a case of when we would have another pandemic, not if, with so much international travel. So I don't know when I'm getting my visa. I'm tired. I'm feeling a bit fed up of some people right now because they're not taking it seriously, but I think they will eventually. I hope that they will. It's just a cultural thing, I think. They think so. Some people are taking it over seriously, so they're absolutely terrified and not moving from the spot, and then other people are making jokes, which is fine, but still coughing into their hands, and I walk around trying to spray their hand with sanitizer afterwards, and they say, I'm going to sneeze again, and I say, but not into your hand, not into your hand. You have to drum this into people. Children are good at remembering these type of things, adults not so much. They'll believe it when they catch it, basically, which is too late. So I think I'm going to use the 21 days to rest, to be honest, to catch up with my Zulu learning. I'm trying to learn Zulu, and maybe we'll be able to download some films to watch. That would be nice. Do some gardening as well. It's an opportunity, I guess, to hibernate. It's 21 days of basically isolation, self-isolation. So I guess we think of it as a holiday, of having a nice 3-week break with nothing to do. I've got all of my instruments, as I said, so that's something, but had children coming asking me for lessons today, and I've just had to turn them away from the room. I can't risk it. I cannot risk anybody's health, basically. I'm not prepared to do that, so I don't think there's anything else to say at the moment other than that I'm feeling drained, and we don't know when the electricity is going to go off yet, but I did cook today, so I've managed to beat ESCOM again. I think it's draining every time I go to psychology, and today was obviously a short session. We were sat far apart from each other. It was almost like apartheid in the health centre. But for everybody's apartheiding against each other right now. So he was sat one side, I was sat the other side. Huge distance between our chairs and the sanitizer in the middle. And when he sneezed, he left the room so he didn't infect me. And came back 5 minutes later. So it's everybody's worried right now, so it's not so weird, I think, that I'm feeling scared for the country and its people. And it did bring on some diarrhea this morning. Before I went to the appointment, I did have several bouts of diarrhea, but it's cleared up now. I'm feeling a bit mentally vulnerable at the moment, so I'm feeling I don't like to sometimes disclose it too much on here, but I'm feeling like at some point soon I might need to cut myself. And I'm feeling like, again, like I'm not sure of myself because I've been very stressed about things and I'm not sure who I am again, whether people want me here. I know that people are looking at me at the moment and asking me where I'm from and looking shocked because they think maybe I've come from Europe recently. And I'm just feeling like I need to relieve the pressure somehow. Saint Helena's still in the back of my mind all the time. I'm wearing the t-shirt today. Saint Helena. Surrounded by saints, you'd think you were in heaven. It's a little bit ironic really from my experience on Saint Helena last, but I'm hoping they've suspended flights to the island because it would be irresponsible to carry on those flights. The cargo ship I can understand, but the flights should not be going ahead from Johannesburg. So St. Helena's already isolated, so we need to keep it isolated really. That's the benefit of it being a small island in the middle of nowhere. But yeah, I'm just feeling a bit down and like I can't do anything to help people. I'm useless at the moment. I'm a microbiologist, but I can't put my skills to use right now except to speak to people who will listen, mainly children. But even that can be difficult. It can be really difficult trying to teach people who have not come across this type of thing before and are not educated in biology or chemistry, microbiology, science background. It can be really hard. It's not their fault, it's just a cultural thing. Some people prefer not to know, some people don't believe, as I said, until it happens to them. And this all came from Italy. It was the two people who went to Italy and brought it back with them. So it started in KwaZulu-Natal, but now there's local transmission and every province in South Africa is now infected. But the most obviously here in Gauteng, which is expected because it's the most densely populated, got the most people. But we're concerned about everybody at the moment, and we're concerned about what's going to happen next, how many more people will be tested positive by tomorrow when we check. It was 402 yesterday. Today it's well over 500. That's over 100 cases, most of them being treated here in Gauteng. So that's why it's a worry with Soweto being on the border of Johannesburg, and people travelling who's still able to go to work. It's affecting everybody. Economically it's going to hit really hard, possibly worse than the 2008 recession, and we just don't know how the country will cope with this at all. We just have to hope everybody sticks to the measures that the government have given very clearly, in a mass communication campaign to reach as many people as possible, and that people can go and before Thursday let people know if they've already isolated. I guess the good thing is that they are isolated. The people that don't know about it, they're probably safer off. But that's the situation here right now. So as I said, my mental state a little bit vulnerable at the moment, but maybe tomorrow will be better. I'm not worried too much about the actual lockdown. I just hope people do adhere to it. The military will be on the streets, as I said, to try to make sure people do, which I think is a good thing, to remind people about the seriousness. And hopefully within those 3 weeks it would have given the time for the virus to stop spreading human to human. So I do think that they've put the measures in place early enough, and had a chance to see what's happened in the rest of the world. So these measures have worked in China, which is where it started, obviously. So we're hoping that that it will help us here. But my psychology, so I'm going to miss 3 weeks now, maybe more. We don't know what the outcome is. It could be back to normal, but with a heavy economic impact. It could be fragile, but okay to go back, or there could be a huge unprecedented disaster, because this country has never faced this before. It's the first time they've actually declared a national state of disaster under the Disaster Management Act during democracy in this country. So it's scary times for all, but I guess it will give me time to make videos over the lockdown period. I'm probably repeating myself a few times now because I'm tired, and I'm kind of feel like there's a lot of pressure on my brain at the moment. But I am feeling like I need to be useful to people here, and at the moment I'm not able to be, even medically. From a biology point of view, it's very difficult for me to be useful to help others. So it's making me feel again like, I don't know, I think I'll go now before I start trying to explain too much. But I will make some more videos during the lockdown period. We'll make sure we're prepared for it and been to the shop. Here, people haven't been panic buying, at least. So, and they're controlling it in the shop, so they'll only let you buy so many of a certain item. So unlike Europe, we can't have a situation where the shelves will be empty, because there are people here that won't be able to get them at the same time, and they'll go without. So yeah, it's all come along very suddenly, since the president was clearly worried when he was giving the speech, but at the same time trying to reassure people that they do have what's necessary to fight this. We just don't know whether there will be a complete catastrophe and we'll have to deal with it, or whether we'll be able to limit it to an extent. Nobody knows. So I think I'm going to go and lie down now and eat biscuits. We're going to eat lots of cake over the 21-day period. I'll have lots of time to bake, so I guess that's therapeutic too. But wherever you are now, all the best. Look after yourselves, and I hope that this comes to an end soon for all of us. We're all in this together, actually, the entire world. So, and for those countries uninfected, we need to help protect them. Mozambique had their first case today, which was really sad. So we really need to try to look after each other at the moment, and that means looking after everybody in the world. So please take care, and I wish you all the best wherever you're watching from, and thank you again for watching. Good night.